Hello, my name is Muthiah Vaduganathan from the Brigham and Women's Hospital and Harvard Medical School in Boston, Massachusetts, and we'll be discussing the FINEARTS integrative analysis of 3 large-scale placebo-controlled trials of the non-steroidal MRA finerenone. Steroidal mineralocorticoid receptor antagonists, or MRAs, such as spironolactone and eplerenone, are strongly recommended in patients with heart failure with reduced ejection fraction. But many patients may have intolerance to these conventional MRAs, largely due to their risks of hyperkalemia. And the evidence base of steroidal MRAs at higher ejection fractions are less well established. FINEARTS is a large-scale randomized clinical trial establishing the evidence for finerenone, a non-steroidal mineralocorticoid antagonist that may have a differentiated safety profile in this target population of heart failure with mildly reduced and preserved ejection fraction. This trial has already randomized 6,001 participants, and event accrual is ongoing. To put FINEARTS into broader perspective of the cardio-kidney metabolic spectrum, this pre-specified pooled analysis integrates evidence from FINEARTS heart failure as well as adjacent populations of patients with chronic kidney disease studied in the FIDELIO program. This was a trial program encompassing patients with type 2 diabetes and established chronic kidney disease. So this integrative analysis included 3 large-scale trials: FINEARTS heart failure, a population of heart failure with mildly reduced or preserved EF, and the FIDELIO program, which was encompassed 2 individual trials, FIDELIO-DKD and FIGARO-DKD. These are patient populations of type 2 diabetes and chronic kidney disease. Overall, this analysis encompassed over 19,000 participants enrolled in these 3 trials. All 3 of these large-scale trials were similarly designed in that they were randomized placebo-controlled trials in which finerenone, titrated to target doses, was compared against placebo in an event-driven fashion, and patients were followed over time. Now, we pooled individual participant level data from these 3 trials to summarize the overall baseline clinical profiles of these patients. Ultimately, when FINEARTS reports, we will have more definitive evidence of finerenone across the cardio-kidney metabolic spectrum. Across the about 19,000 participants enrolled across these 3 trials, we found that the mean age was about 67, about 35% of individuals were women. These patients were well treated on background medical therapies with high use of renin-angiotensin system inhibitors, which were indicated in patients with type 2 diabetes, chronic kidney disease, and for some indications in patients with heart failure with comorbidities. In addition, about 10% of individuals were co-treated with an SGLT2 inhibitor in the trial. These patients had broad-ranging kidney disease risk. Over 50% of participants had an eGFR less than 60. Furthermore, almost 80% of patients had high degrees of albuminuria, either A2 or A3. So we believe that those 19,000 patients represented a very high risk, not only for cardiovascular events, but also for kidney disease progression. So while trial follow-up for FINEARTS is still underway, we anticipate that approximately 530 cardiovascular deaths will occur during the course of the trial. So taking that together with the cardiovascular deaths that were experienced in the FIDELIO program, we have over 1,200 cardiovascular deaths that would be represented in this patient population. That improves the precision of our estimates of finerenone on a otherwise relatively infrequent event like cardiovascular death. And so this will provide more substantial evidence base for how this drug works in potentially attenuating cardiovascular risk, including mortality outcomes like cardiovascular death.